Before you start minoxidil, finasteride, dutasteride, or any other hair loss treatment, there are 5 blood tests I think you should get done first, because your hair follicles are one of the most metabolically active tissues in the body, which means deficiencies, hormonal imbalances, and underlying health issues often show up in your hair long before they show up anywhere else. And that's where a problem that seems completely unrelated to your scalp can sometimes be the very thing preventing your hair from growing properly. So in this video, I'm going to walk you through the 5 blood tests I recommend, and more importantly, the exact numbers I'd like to see for healthy hair growth. Stay until the end, because the last 2 tests are the ones I see overlooked the most, yet they're often the missing piece behind why someone's hair loss isn't improving the way we'd expect. Hi, I'm trichologist Bobby Spence. I'm a certified trichologist and hair loss expert with over 20 years experience. I've helped thousands of patients improve their hair growth and their hair density. Test 5, B12. The first blood test I recommend checking if you're dealing with hair loss is vitamin B12. B12 helps your body produce red blood cells, and those red blood cells are responsible for carrying oxygen throughout the body, including your hair follicles. If your B12 levels are low, your follicles may not get the support they need to stay in the active growth phase, better known as the anagen phase. I tend to see low B12 levels come up most often in a few specific groups. If you're vegan or vegetarian, you're naturally at higher risk because B12 is found primarily in animal foods like fish, eggs, and dairy. I also see it in people taking medications such as metformin or long-term acid reflux medications, and in people with digestive issues that affect nutrient absorption. What I see quite often is someone being told their B12 is normal because they're above the deficiency cutoff, but when I actually look at the number, it's sitting right at the bottom of the range. And that's where the conversation gets more interesting, because the number your lab uses to flag a deficiency isn't the same number I'd want to see in someone trying to support healthy hair growth. Many labs won't flag B12 until it falls below roughly 200 picograms per milliliter. For hair growth, I generally prefer to see higher, somewhat in the 300 to 900 range, rather than hovering just above the deficiency threshold. So if you fall into one of those higher risk groups, or if you've had your B12 checked before and were simply told it was normal, it's worth going back and looking at the actual number. Test 4, zinc. The next test I want to talk about is zinc. Zinc is involved in how your body repairs and grows hair tissue, and it also plays a role in producing keratin, which is literally what your hair is made of. When zinc drops, you usually notice it first as dryness and brittleness, and if it stays low, you'll start to see some real shedding. I see low zinc come up a lot more than you think in women with female pattern hair loss. I also see it in people on really restrictive diets or anyone with Crohn's or IBS, since those affect absorption, and also in people who drink heavily. Alcohol burns through zinc stores over time. One thing I always warn my patients about is zinc and copper levels need to stay balanced. If you start taking zinc supplements without guidance, you can actually tank copper levels. So if your zinc comes back low, I'd also recommend checking your copper levels, since these 2 minerals need to stay in balance. For numbers, labs call 70 to 100 micrograms per deciliter normal. For hair, I want to see zinc levels in the upper half of that range, not just barely above the range. Now we've covered B12 and zinc. I do find abnormalities in both from time to time, but they're usually not the first thing I expect to see when someone comes to me with significant hair loss. The next 3 tests are the ones I pay the closest attention to. The first of those is your thyroid panel. Test 3, thyroid panel, TSH, free T3, and free T4. Your thyroid controls your metabolism, and your hair follicles are incredibly sensitive to thyroid hormone. Doesn't matter if your thyroid's underactive or overactive, either one can cause diffuse shedding, which means it spreads across your whole scalp instead of showing up in just one spot. This is one of the causes I see missed constantly, because most checkups stop at TSH and they call it a day. But TSH alone really doesn't tell the full picture. The first marker is TSH, which is the signal from your pituitary gland telling your thyroid how hard it has to work. Most labs consider roughly 0.4 to 4.5 to be within normal range. For hair growth, I generally like to see is somewhere between 1 and 2.5. Then there's free T4, which measures the main thyroid hormone circulating in your bloodstream, and free T3, the active thyroid hormone your cells actually use. I've seen patients whose TSH and free T4 were both well within range, yet the free T3 was still low. That's why I like having all three values available rather than relying on a single number. So if you've only ever had TSH checked, I encourage you look at the free T3 and the free T4 as well, especially if your shedding is diffuse, or if you also get fatigue, unexpected weight changes, cold hands and feet, or thinning eyebrows alongside the scalp loss. Thyroid-related hair loss is one of the most frustrating things to deal with because it can go undiagnosed for months. But once it's caught, it's also the most straightforward to actually fix. Okay, we've covered B12, zinc, your thyroid. Now the two that matter the most. These are the ones that show up in nearly every study that I've read and nearly every real case that I've actually treated. Test 2, ferritin, iron panel. Number 2 is ferritin, your iron storage protein. Ferritin tells you how much iron you actually have in reserve. And something most patients don't realize is that your body treats hair as expendable. The moment your iron stores drop, your body redirects the iron away from the follicles first to protect your heart and brain instead. This is one of the most well-documented things I see, especially in women. The research backs it up too. Women dealing with chronic telogen effluvium and female pattern hair loss consistently show lower ferritin levels than women who aren't losing hair. I see it in most other women with heavy periods, anyone on a vegetarian or vegan diet, anyone with a history of anemia, and women who've recently given birth. The normal range for ferritin is huge. Labs will list anything from 15 to 150 is fine, so a result of 20 technically passes. But for hair growth, the number is way too low to do you any good. I want your ferritin above 40 at the absolute minimum, and honestly, I'm aiming for 70 to 100 if we're trying to actually fix the shedding. Anything under 30, and we're in a range that's consistently tied to active shedding in most research. I'd also recommend looking at the full iron panel rather than ferritin alone. Your serum iron, your TIBC, your transferrin saturation as well. Because ferritin can read artificially high when there's inflammation in the body, even when your actual iron stores are low. One number doesn't tell the whole story. Test 1, vitamin D. Now, the tests I see come up more than anything else in hair loss is vitamin D. Something that throws a lot of patients off is vitamin D isn't really a vitamin in the way we normally think about it. It behaves more like a hormone and is directly involved in your hair cycle. Your follicles actually have vitamin D receptors built into them. When your levels are good, it helps push follicles into active growth phase and it keeps them there. When it's low, follicles slip into the resting and the shedding mode earlier than they should, and that's what shows up as thinning across the scalp. I've seen vitamin D deficiency tied to telogen effluvium, where your body's under stress and pushes hair into the shedding phase. Female pattern hair loss and alopecia areata too. That's autoimmune. And study after study keeps showing or finding vitamin D in people when it's compared to people without it. And this is incredibly common. If you're indoors most of the day, or if you live somewhere without much sun, or you have darker skin, which naturally produces less vitamin D from sunlight, you're at a higher risk of running low without even knowing it. So what's the correct range for you? On a standard 25 hydroxy test, labs call anything above 30 to be sufficient. I think that's too low for hair growth. I want my patients between 50 and 80, and anything under 20 I would consider a real deficiency tied directly to increased shedding. If you've had a vitamin D blood test checked before in the past and someone told you you were fine, go back and actually look at the numbers yourself. Don't take their word for it. So to bring it all together, the 5 tests I want you to take away with are vitamin D, your ferritin, your full iron panel, a complete thyroid panel covering TSH, free T4, and free T3, zinc, and B12. But the biggest thing I want you to take from this video is that hair loss isn't one single condition. There's several different types, and each one needs its own approach. The mistake I see people make over and over again is jumping straight into treatment before they even understand what they're treating. That's exactly why I made this next video. Inside it, I'll break down the 4 most common types of hair loss, how to identify which one you're actually dealing with, what typically causes each condition, and which treatment genuinely makes sense for each one. Because hair thinning isn't one problem. It can be stress-related, hormonal, autoimmune, or genetic. And if you don't know which category you fall into, you can spend months treating the wrong thing while your hair continues getting worse underneath. So before you start building a protocol, go watch this video next.